you're at UNC, which is one of the premier universities in the country. And my curiosity is, do you ever have somebody, a student, walk in and say, hey, what do I have to study to get into the role that you have? Or what kind of path did you take to get into the role that you're in?
That's a great question. And I suspect there may be peers in our industry that would share this sentiment. I'd be interested to know that. But, I'm always sort of jealous or envious, I should say, probably, of those folks in our industry who've come from the clinical side. My boss, our CIO, who's been with UNC Health now for 39 years, she was a nurse and started her career as a nurse and moved into nursing informatics and then into IT, and now is the CIO for UNC Health. And I think those are always really exciting pathways. And we've got others. We have a pretty large number of clinicians that have made the jump into IT or informatics that are a part of our team. And I think those are really exciting pathways. And I see a lot of energy about that. For me, I went maybe more of the traditional route, which was an electrical engineering degree at NC State. And then I did my MBA at UNC. I think that pathway still works, but I have enjoyed being a part of our academic arm that is what we call our Carolina Health Informatics program. And if you'll allow me just for a minute to go down a little bit of a tangent here, it is something that I think is directly related to your question. UNC and Duke had partnered about a decade ago to put together this health informatics program. And it's started out as a certificate, then a master's, and now a PhD program. And I think folks that are coming either from sort of the business IT side or coming from the clinical side, I think that's a really nice way to get involved in health IT and what we're doing. We've hired a number of graduates from that program from both UNC and Duke into our team, and they do amazing things. They have a really unique perspective that they bring to what we're doing, and really in terms of that relationship between the provider, the care team, and the patient, and a lot of the exciting things, especially now around digital health and consumer-oriented health, that they have got really unique perspectives. So I think any of those pathways are great. I probably, like I said, I'm envious of that clinical pathway to get here.